topics and opinions expressed in the following show are solely those of the hosts and their guests and not those of W4CY Radio, its employees, or affiliates. We make no recommendations or endorsements for radio show programs, services, or products mentioned on air or on our web. No liability, explicit or implied, shall be extended to W4CY Radio or its employees or affiliates. Any questions or comments should be directed to those show hosts. Thank you for choosing W4CY Radio.
Welcome to the Ask the Expert show on W4CY Radio and Talk4 TV, where we bring you educational information from top local experts in the fields of legal, health, financial, and home improvement. Now sit back and listen to experts in family law, association law, hearing loss, business brokers, home care, along with many other topics. Now here are your hosts, Steve-O and Sophia.
Hey, good morning, New York. Welcome. Or should I say snowy New York? Welcome to another Ask the Expert show, where for the last 16 years, we have brought you the top experts in the field of legal, health, financial, and home improvement. Today's a very special show because we're going to be talking about Medicare today. We're going to be talking about, I guess it's a subject dear to my heart, because I'm on Medicare. And not only am I on Medicare, but I'm on Medicare Advantage. We have got the greatest agency in the New York area. Let me welcome from the Alcorn and Associates, Dan Alcorn. Wonder how you got the name of the company, Dan.
Something I could remember, Steve. Good morning and Happy New Year. We haven't chatted since the holidays. Hope your holidays were great and your new year is off to a fantastic start. And yes, thank you for having me. If you can see over my shoulder, the snow on the roof is, you know what we call this in upstate New York?
What?
Tuesday.
Why is that?
It's just another day. It's just, it's in January. You're upstate New York. Of course, there's snow on the roof. And so, yeah, hope your new year is off to a great start. And thanks for having us this morning. My team is out Dan, in the field. And go ahead, sir.
Tell us about Alcorn and Associates.
So we're a team of independent licensed agents, life and health insurance agents based in New York, covering from the Canadian border to Buffalo to Long Island. We're also licensed in other states, including your home state of Steve. We're not employed by the government or any one of the companies that are out there. You know, you go to Medicare.gov and put in your zip code and you can see plans that are available in your area. We represent many of those companies, but not all. And we work through, the local network of providers and facilities and try to match our local clients with a plan that is local in their community. And we just went through the annual enrollment period and assisted over 900 clients with just moving from one plan to another because their plans were terminated for 2026. So yeah, we just came off a rather busy season.
Dan, I'm going to tell everybody something because I want people to understand how important it is to have a good agent. Because I think I've shared on the show before, I started off my first year and I didn't know, because we don't know what's good and what's bad. We have to take the agent's word for it. But I learned that he was very lazy. He was like you, he represents multiple companies, but he only showed me one plan. And I've learned from you, you will show your clients multiple plans for them to choose from. And it was almost like he did no legwork. And I've learned you guys do so much legwork to find the right plans from your client. So I want people to know also, these national commercials you see, some of them sound too good to be true. And I think they are. But what I did is I called some of those companies, and it's amazing. You can get 2 or 3 different answers from the same company. That's why having a good agent like yourself to work all this out for you. So I had
locally.
to put that in.
Yeah, well, thank you, Stephen. And we believe that healthcare is local.
Mm.
Again, we represent several national companies, but also some plans that are local. But just yesterday, I was speaking with a new client who had been enrolled in a plan through an 800 number during the most recent annual enrollment period, which ended in December. And the well-intentioned agent on the other end of that 800 number was not aware of local contract issues. You see, these Medicare Advantage plans sign contracts with your local providers and hospitals and the like. You, Steve, are like myself, we are on Medicare. We're on different company plans. But I will say that the plan that I'm on and the plan that you're on works very well in your local community, but it may not work in our respective communities. The one you're on that works well for you in Florida may not have a contract with the company, with the providers and hospitals here in the New York region, and vice versa. So it's really these agents are well intentioned, but they're not as aware of what's happening in your local community as a local agent.
Exactly.
Got a little
A
feedback.
lot of things going on now. And I am surprised, first of all, why are there companies that are dropping out of county?
Yeah, that happened for effective January 1st. 1 million people, Steve, were enrolled in 2025 in plans that were discontinued. And so, they lots of folks right now are just getting acquainted with their new plan and may or may not find that plan matches their providers or their prescription drugs. Why are they getting out? It's always money. And these companies are under pressure from the government, from the provider networks, from consumers like you and I, and in some cases under pressure from shareholders. So they have to figure out which regions they can operate in and at least break even. And in the case of the for-profit companies, actually have a return. So it's a reset time. Some of it is driven by the drug reforms, which are resulting in lower costs for consumers, but higher costs for the carriers, and so they have to shift that around. So, yeah, that's another topic itself. We can schedule that one for February. Why are these companies losing money in some areas? Yeah,
exactly. So, Medicare Advantage open.
I'm sorry, Steve, you broke up.
Let's talk about the Medicare Advantage open.
Yeah, the open enrollment period is there's not to be confused with the annual enrollment period. From January 1st through March 31st, individuals that are currently enrolled in a Medicare Advantage plan, that's you and I, we have an opportunity, believe it or not, to one more time review alternatives and make a change for one time during that 3-month period. Let's say that you were one of those individuals that your plan was terminated, you enrolled in something for 2026, and come to find out it doesn't work as well with your providers or your medications as you wished. So you have this open enrollment period just for people on Medicare Advantage. You can return to Medicare, original Medicare, or choose a different Medicare Advantage plan. So that gives folks some flexibility during the first 3 months of the year. What you can't do is if you're on original Medicare, you can't enroll in a Medicare Advantage. This is just for people who are currently enrolled in a Medicare Advantage plan. You can go back to original Medicare and add a supplement or a drug plan to that, or switch to a different Medicare Advantage plan if you wish. If your plan's working for you, No, really no need to, but this is for those where come to find out that first 3 months that what they enrolled in doesn't really work as well for them as they expected. Great question. Thank you.
We're getting a lot of people, this is an older demographic, and they don't always read all their mail. And I'm getting letters from people going, I didn't know that my company is no longer carrying my area. Again, this is another really good reason why you should have a agent like Dan, because we understand that not everybody reads all their mail and they don't know. They just figured, or my policy is just going to continue on. Do you have those kind of calls, Dan?
Yes, but we make a point during the month of September to start sending out early notices to our members that we know we're going to be affected. By the end of September, the carriers, whichever company you're with, also sends a notice. And then we have throughout the September, October, November, been reaching out through mail, through email, through telephone calls to let people know that their plan was being discontinued and they needed to find an alternative for January 1st. Our score was 900 to 6. We just couldn't reach 6 people, but the other 900, we got them all into something that we think is a good match for their needs. But again, if it turns out not to be the case, then we have that open enrollment period. Let me give you an example, Steve. We have one carrier here locally that is in the middle of renegotiating a contract with a hospital and that hospital provider group. That contract expired December 31st. So individuals who are enrolled in that company who go to that hospital and their provider network are saying, well, what do I do? And we're saying, give it a few weeks. But if the contract doesn't get extended or renewed, you have that open enrollment period to make a change if that affects you. An 800 number agent would not know that.
Right.
They just simply don't know and by the way, I don't know what's going on the ground in, St. Louis or Portland, Oregon, or Houston, Texas. You have to be in that local community to know what's happening with those local providers and those companies, whether those companies are national or local. That's healthcare is local.
So we just got a text in from Syracuse, New York.
Go Orange, man.
Paul wants to know, he said, I just found your show. I am so glad there's a show like this out there. I might have missed it, but what is the difference between regular Medicare and Medicare Advantage?
Great question. So I call that the 3-card versus the 1-card solution. Original Medicare is that red, white, and blue card you get from the federal government, which has parts A and B. Think about A as being admitted to something. B would be your doctor's lab work and like. Original Medicare doesn't include prescription drugs, so you add to that a second card, which would be your drug card. And then because Original Medicare doesn't include 100% coverage, you would pick up some sort of a supplemental plan to pick up, let's roughly say Medicare covers 80%. That 20% piece is your responsibility. So there's a third card, and I call that the 3-card: Original Medicare, the drug card, and a supplement plan of some sort. Or, and it is an or, you can choose a single Medicare Advantage, which combines, it's called Part C. It's not what it stands for, but I think you remember it as it combines your Part A, B, and D into one card. It's managed by a private company, alphabetically. You'll know the names: Aetna, Blue Cross, Humana, Anthem. That's not alphabetical. United Healthcare. Those are national companies which manage your Medicare benefits through what's called the Medicare Advantage plan, one or the other. There's no right or wrong. It's what works for your situation, your doctors, your drugs, your travel plans. You may have a home here in New York and a home in Florida, so we want something that works on a national basis. So we work through that with every individual client to see what makes sense for them, at least for the foreseeable year.
This is from Mike in Scarsdale. Great show. I have a question. I hope no one has asked this. What happens if I choose the wrong Medicare Advantage plan? Can I make a change in 2026?
Great question. And coming from Scarsdale, that means you're a resident of the state of New York. Nationally, everybody has that January 1st through March 31st open enrollment period. But we say for New York residents from April through the end of the year, you have what's called a special enrollment period if you belong to something called New York EPIC, NYEPIC. It means elderly pharmaceutical insurance coverage. EPIC members get yet another opportunity to change their plan during the year. There are other special enrollment periods, like say you may qualify for Social Security extra help, or be enrolled in New York State Medicaid, or change your address. So there's the annual enrollment period in the fall, the open enrollment period, January 1st through March 31st, and then there's special enrollment periods throughout the remainder of the year that can help you. You're not married to these plans forever. And in fact, there may be, several opportunities each year to change if need be. Great question.
Here's another one from Mike in Brooklyn. He wants to know, how are New York rules different for enrolling in a Medicare supplement plan?
Very different. And that's a unique. Medicare supplement plans in New York can be a little bit more expensive than other states because they're not health plans. They are insurance policies, which means they're governed by the state of New York insurance regulator, which means it's guaranteed approval. So there's no underwriting. Continuous open enrollment, which means you can enroll in a supplement plan. Remember the 3-card plan any time of the year. And it's community rated, which means there's no difference in premium based on gender or based on your health condition, based on whether you're a smoker. That does not apply. That flexibility does not apply in other states. In fact, Steve, I've had some clients relocate from New York to your part of the nation, want to enroll in a supplemental plan in your state, and were denied because they take Eliquis. That just doesn't happen in New York. It's guaranteed approval, continuous open enrollment, community rated. And by the way, because it allows pretty much everybody to get a supplement plan, those who are not as healthy are enrolled in those plans, and so the claims are higher and the premiums are higher. But it's really that's a great question, and it's something that's very unique to New York State.
Can we talk about this high deductible Medicare supplement plans?
Certainly. So when we talk about those 3-card solutions, and we have a lot of information about this on our website, www.dgalcorn.com. So you have Original Medicare, which pays its share, and then Medicare Parts A and B have a deductible amount, and then roughly an 80-20 share, which means Medicare pays its 80%. You're responsible for 20%. There are several ways by which you can address that 20%. There's a plan G, there's a plan N, and then there's the high deductible amount. I don't know if we can share, but on my website, can we pop over to that? There we go. On our website, here we go, under dgalcorn.com, there's a page on there about the high deductible. And if your viewers can see this, think about this, that your maximum out of pocket, when we talk about high deductible, many people think, Steve, that is your first dollar deductible, which means you pay X before your plan kicks in. With these Medicare high deductibles, it's your copay is limited to, well, it's $29.50 in 2026, which means you pay not the supplement plan. You pay the Part A deductible and the Part B deductible and that Part B 20%. But once your out of pocket hits $29.50, you have 100% coverage, and there's no network, which means you don't have to worry about whether or not your company is in contract discussions with your doctor or hospital. So this is a very competitive, and financially it works out. You've got to do the math. We call it Medicare math. But if you were to look at this compared to a regular supplement plan G or plan N, sometimes the math is compelling. I say to folks, if you're going to do the 3-card solution, original Medicare, a drug plan, and a supplement plan, that supplement plan can be pricey. It can be $300 or more a month. These high deductible plans have lower premiums, but this out of pocket is $29.50. Put the money that you were going to put into the $300 plan, put it in a cookie jar, pay your copays, and once you've capped at $29.50, you should have money left over. And I sort of half-heartedly say, well, throw yourself a terrific New Year's Eve party, because this financially works out very well. It's not for everybody. But we have lots of clients on this because they get the flexibility of seeing any doctor in the United States, no network. Their out of pocket is capped at $29.50. You know, these Medicare Advantage plans have out of pocket maximums anywhere from $7,000 to $13,000, whereas this is capped at $29.50. Again, and I'm glad we could share this on the screen, but if you go to dgalcorn.com, and you look under Medicare supplement plan, there's a special page just for these high deductible plans. They're very competitive. Thanks for asking, Steve.
Well, one thing about your show, it goes by fast. Tell people how they can reach your office, Dan.
Certainly. We have, as I mentioned, agent servicing from Canadian border to Long Island. We're at 518-346-2115. Or our website is www.dgalcorn.com, where you can find an agent in your region of the state or in other states. We're in Florida, Massachusetts, New Jersey, other states as well. And we offer everybody, of course, a no obligation, no fee consultation to just make sure what you are currently enrolled in matches your doctors and medications, and answer any general questions.
Hey, Dan, we're so lucky to have you. Dan will be back again with us next month. Mm-hmm. Hey, I know you're busy now. Have a wonderful week. We'll see you soon.
Thank you, sir. Happy New Year to you all, and stay warm down there in Florida.
Thanks, Dan.
All right.
We'll see you soon. We're going to go to a break. We'll be right back.
Thanks for tuning in today to the Ask the Expert show on W4CY Radio and Talk4 TV. Tune in next week and every week to hear more from our experts on personal injury, insurance, air condition repairs, estate planning, Medicare, and many other topics in the areas of legal, health, financial, and home improvement. See you next week.